Hello and welcome to my video channel. My name is Dimitri and I'm a physiotherapist. I'm currently working in Plovdiv, Bulgaria, and my topic of interest is neurological rehabilitation. My clinical experience is mostly with spinal cord injury patients, elderly patients with stroke, also traumatic brain injury patients and children with cerebral palsy. So probably you're not very familiar with the situation in Bulgaria, but right now our healthcare system is not in good shape. So for example, stroke patient or traumatic brain injury patient, and even the spinal cord injury patient will have only 14 days for a year to do any specific rehabilitation, which is not much. The cerebral palsy patients, they have 10 days a month, which is a little bit better, but still it's not perfect. So the family of a patient with a stroke or a traumatic brain injury patient or a spinal cord injury patient will have to look for other options, and usually they are inviting physiotherapists to go and work directly with the patients at their home. This is good in one way, but is bad in another way. So how it is good? It's good because you are choosing the therapist, and when you are paying him, you're actually ensuring that you will have the best of his experience and motivation. It is bad because when you are inviting just one therapist, it is actually that's it. You're having just a therapist, just a physio. You don't have a team. You know, just one therapist does not equals a team. When you have a team, when you have a complex patient, this patient will have he has a certain needs, like a traumatic brain injury patient, for example, may have problems swallowing food or water, and he or she will need a speech therapist with clinical experience to do some special massages, to educate the parents or the relatives of the patient how to do this. If you have a patient with spinal cord injury, for example, C5, C6 spinal cord injuries, and you know you have some movements in the arms, but your hands are out cold, you need occupational therapists to educate the patient how to use different devices so he or she can feed himself, or shave or whatever. Also, this therapist will educate the patient how to do some activities of daily living as exercises, which is a part of the rehabilitation of this patient. It's not like a physio cannot do this, but you know, when you don't have the clinical experience and you have to open different websites and you have to look something up in different textbooks, it's not like this is the speciality of the physiotherapists. So a physio cannot adequately replace occupational therapists with, for example, 15 or 20 years of experience working with spinal cord injury patients. Okay. What else? You may need a social worker. You may need also a psychologist. Usually, families who have to take care of patients with traumatic brain injury, coma patients, or cerebral palsy patients. These families, they are put in a lot of pressure. So a psychologist is always a good idea, just to consult the people, to help them vent the pressure out. So a physio can be helpful, but he or she cannot replace a psychologist. Also, a hand therapist, there are certain individuals who are very proficient in working with specifically with the hands of the patient. Of course, when you have some pressure wounds, you need a nurse, and even you need a doctor or a surgeon. You know, a team is always better than a single therapist. So I'm sure that not all the countries outside of Bulgaria have the same problems we do, but it's always good to remind the patients and the family of the patients and the young therapists and students that a team is always better than a single therapist. So thank you for watching this video. I hope you find it useful, and if you haven't subscribed to my video channel, do it now. Give the video thumbs up and share it if you like. If you have any comments, just leave them in the comment section below. Thank you for watching this video.